Well, Alzheimer's is one of the top 10 leading causes of death here in the state of Alabama. That's according to the Alabama Department of Public Health.
But those who study the disease say early detection can be key. Our Taylor Pollock on your side tonight with how a local clinic is helping out with some nationwide research. And Taylor, what's the clinic doing?
Yeah, that's right. The Community of Hope Health Clinic in Pelham is one of just 5 across the nation that's testing out a new toolkit that they hope will help medical providers recognize the early signs of Alzheimer's.
I've had a number of people within my family who've had Alzheimer's and dementia.
Dr. James Kilgore has worked with Alzheimer's studies for years, and he also knows firsthand how devastating it can be to patients and their families.
It is extremely hard on families. It's expensive, the time that the families have to put in to take care of them, the limited resources that you have available.
But he's optimistic about a study his clinic is participating in that's providing a simplified way for medical providers to screen patients for the disease.
Medical providers say they don't feel comfortable in identifying these patients and diagnosing it. So they've come out with some new screening tools which are simpler to use, and for the primary care providers in particular, they can do this at a well visit, a regular office visit, and identify those patients and score them.
They're also creating a database in the process and are already noticing patterns.
Patients that have scored low on the screening test, that we've further evaluated them. The younger patients, a lot of times we're discovering that they may have depression or some other medical problem related to medication, and we can intervene in that early.
Kilgore says it's clinics like this one that need to help with this study.
In the rural and underserved areas where you don't have specialists, the primary care providers really need these tools so they can identify those patients that are high risk.
Now, this study is going to last for about 3 months. It's going to wrap up in August, and then after an evaluation of what all was learned, that toolkit will roll out nationwide sometime this fall.